I was previously executive director of Susan G. Komen, Central and Eastern Virginia. And it was during that time that we were hosting Race for the Cure every year. And there was this recurrent theme when people would come to our survivor tent every year of loving the community and even the small services that we were providing, like the head and neck massages or the mindfulness or yoga on site. But they kept saying, I just wish this were every day. And as I noticed this trend over time, I kept wondering, what if it were? What if this were services and a community space that we could provide for cancer patients and survivors and their family members every day? And that's basically where Cancer Retreat Centers was born.
Can you tell me a little bit, can I ask you about yourself personal and
Yes.
kind of your journey?
You got it, yes. So I was diagnosed the first time in 2012 with stage 3 breast cancer. It's a subtype called triple positive. I know this is October and Breast Cancer Awareness Month, so great time to put a plug in for that. I received about 19 months of chemotherapy, radiation, bilateral mastectomy with reconstruction, but just a few years later in 2016, I was diagnosed metastatic, which means it had recurred and spread beyond the original site of origin, so in this case into my bones. And I've been living with metastatic breast cancer since 2016, but thanks to improvements in technology and treatment, I'm still working full-time and going strong. And that's the blessing. And that's, I lost my mom to breast cancer when I was 25. So I have a very unique vantage point in this space. I actually was 4 years old when she was diagnosed the first time. I was 24 when hers recurred. I was the caregiver for her at that point until she passed away. And then I was a young survivor with stage 3 and then a young metastatic thriver by age 36. Then I've also been working in this space now for almost 10 years. So professionally, personally, I've been able to combine all of this experience to really help identify these unmet needs in the cancer space and a tenable solution that we might be able to meet them together.
Can you tell me a little bit about, did someone approach someone first?
Yes.
Can you briefly talk to me about that?
Yes, so I've actually been working on this project for about 7 or 8 years. It was something that I started dreaming up when I had the thought, what would this magical space that would provide these integrative cancer care therapies and build community look like? And we started doing some focus groups actually, and even informal conversations talking with other survivors and families to find out what that would be. And a recurrent theme that kept emerging was outside of the clinical environment. Because we have so many doctor's appointments and we're in the clinical space so often, the idea of a space that was sort of medically neutral would be the most attractive. And so then I started thinking, well, I'm a little extra in this way. If we took it up a notch, what would that look like? And I thought it would be amazing if it felt almost resort-like, like truly a treat, a space that you actually want to go to, because that's incentivizing too, for our health and wellness to want to go back regularly. And then we drove around town, probably looked at over 100 houses, I guarantee. We considered so many under the sun, and this is my board and me working together. And then I kept coming back to Blanton House, and I thought, it's owned by the city. What are the chances? We've got this really great business model. Is there an opportunity for collaboration? And so I reached out. I'm also very persistent, as Chris will tell you. I knew we had a really good idea and a great way to serve the community together. So I just kept calling and knocking on the door until Chris scheduled a meeting with me, and that's how it all started. But it was a huge blessing. We sort of, we joke, but it's true, we have a divine tailwind to a certain degree, in that, sometimes life and the right people and the right good intentions align at the perfect time, and this is one of those. Chris lost his mom to cancer when he was younger too, so he truly understood this need and this space. The continuum of care that is needed, the number of people who need to benefit, and in this case, 60% of our programs are for patients, survivors of any age, any stage, previvors, so those with that are high risk, that maybe have a strong family history, family members also of any age, any stage, so that's children through adults, caregivers, maybe related or professional, and oncology healthcare providers, because as we saw during the pandemic, there's a huge need to support, to help our helpers. The other 40% of our programs are available to the general public because we believe in risk reduction, education to learn about our risks and ways that we can prevent chronic diseases like cancer, and health equity. This is a way that we're able to provide these services for free by all collaborating together. So all of our programs at Cancer Retreat Centers are free for all of our participants. We're also near a bus line, so we're addressing barriers like transportation. And starting in 2025, we will have free on-site childcare.
It's a lot.
It's a lot.
And I feel like you can keep talking about it. But I wanted to ask you,
yes.
to reset my shot, how does the Blanton House fall in line with just your dreams and kind of what you saw that this could be?
This is the most ambitious, fulfilling, exciting project I've ever chased. I definitely am a dreamer. I'm someone who loves the idea of developing a tenable solution for an unmet need. But this one is by far the most exciting because it's so collaborative. I have loved being able to feel part of the team at Parks and Rec. I feel part of the teams with our community partners that have stepped in. I mean, at this point, through a strategic mission collaboration with Richmond Parks and Rec in this beautiful shared space with 200 acres of walking trails and tennis courts and lakes for us to use and enjoy, in addition to partners like Bon Secours, who are supporting, the services, the direct services that we're providing, like support groups, mindfulness instruction, nutrition counseling, yoga, some of these incredible integrative cancer care therapies for our community. And then community partners like Greenfront Furniture, who've provided all of this beautiful furniture for our use that's comfortable and soft and welcoming and exactly what our patients want and need to be able to linger for a while. And H.J. Holtz and Son, who came in and helped us actually restore this space to its original look. There was drywall that was not original to the structure from 1920 that they helped us remove and did the plaster and construction repair and painting that brought it all back to life, giving this beloved historical treasure a new modern mission.
Sounds expensive, I guess, also. So you must need help?
We do. Thank you for asking. Yes, so we have been so blessed. To date, all of these improvements have been donated in kind by our community partners. So this has been Greenfront Furniture, H.J. Holtz and Son, Benjamin Moore, Spectrum Paint, Palette Home with Barrow and Ball, Costin Floors that are flooring repair. We've had so many. We have West Hampton Cabinetry Company bringing in some new built-ins next week. We have so many incredible partners from our community that have gifted us with this space for our patients and families and larger community to enjoy.